is. Yeah, it's very sensitive.
Was it?
Don't make me laugh. I like felt that one like all the way down. Oh, that's weird.
Chiro cracks. Chiropractics for everyone.
I drive a lot, so I try to like remind myself to stay upright.
Good.
But it hurts.
Pinchy feeling, is that present every day?
2 to 4 times a week.
How often do you see a chiropractor now?
Like twice a week.
That's a lot. How long have you been going twice a week for?
Like the past couple of months. Yeah, I try to stretch every day, sometimes twice a day. You know, every once in a while I'll get those days where I don't do much, but then I hurt. So I'm like, oh yeah, I need to do this.
Have you ever tried PT?
Professional physical therapy? No.
Do you ever have to take any medicine for the upper back?
Now, no. When I was growing, I had really bad growing pains. So I took a lot of medicine then because it was really painful.
It's been there for a while. It's pretty frequent. And how bad does it get? 10's the worst pain ever.
Maybe a 5 or 6. I don't think I've ever gotten it like, not since I've stopped growing. It hasn't been like, that was like max.
Yeah.
That was a 10 then.
Any other major accidents, injuries?
I know like when I was little, I had like a cyst in my neck that they had to like drain because it was really big.
Did your chiropractor take x-rays of you?
Yeah. I know the way your neck is supposed to curve. Mine curves backwards. Mine's literally the perfect C shape opposite direction. And then my spine, the lower area was very obviously like major scoliosis curve.
Most likely, this is what the scientific literature suggests, that the curvature in your lower spine and the pain in your upper back are all going to be a result of that loss of your cervical lordosis. So that is the primary thing to work on, which is better to work on at home every day. So I'll show you how you can do that. In the meantime, I'll adjust everything else in your spine that needs to be adjusted and then figure out what's the best way for you to like continue to grow in alignment. That way you don't have to go to the chiropractor twice a week. That's too much. Looking at the feet, heel strike, mid stance, and toe off. There's just a little bit of eversion, but it's bilateral and symmetrical, which suggests that it's normal. Looking at the feet coming back this way, much more straight away. I don't see any pronation, supination. I don't suspect any loss of arches, but we'll have to get under there to see. All right, looking at the hip height, we most likely have a higher left hip by this angle. We'll have to check that. Good. And then a high left shoulder as well. Let's see it on the way back. Okay, good. Yeah, I see high left hip, high left shoulder, high left mastoid process on the ear. Okay, so just a little bit of lean in that way, which means we would expect to see a curvature. All right, arches are definitely intact. Go ahead and turn around the other way. Good. Looking at the Achilles tendon, there's no bowing, no pronation, no supination there. Just observing the spine first. You can see the left hip starts to come up a little bit. And if I'm going to put my fingers on top of your hips, okay?
Okay.
We're going to be able to see that discrepancy. It's very apparent. You can see the tilting of the sacrum and the entire pelvis is going this way. The curvature follows suit in the thoracolumbar spine. It's curved. There's an apex convexity on the right. So here's our apex, and there's also a rotation because the musculature is more prominent on the right versus the left. Tone is like the amalgamation of all the layers: bone, marrow, blood, nerve, muscle, ligament, fascia, skin. Every layer has an electromagnetic pulse. Can we do a temperature evaluation? The back of the hands. Good, very symmetrical, cool, no excessive dampness or dryness on the skin. It really becomes much more prominent in the upper thoracic once we get to the level of about T4, 3-4. Okay, I'm going to palpate the SI joints. Open, close, open, close. The right side is moving nicely. It's the left side which just lags a little bit. So we'll check the left SI. You're gonna feel my fingertips on your hamstrings, okay?
Okay.
Okay, feet are even, then looking from the top. Good, we're accentuated on the right. So the right one is like lower and out. And so that means that the pelvis is rotated back and out like that. It is hypertonic on this right side. This right glute is hypertonic. I'm gonna check the movement of the sacrum versus the ilium. Okay, go ahead and bend forward. Come back up. Good. So there is movement there. Let's check the right. Okay, go ahead. Right side. Saw the compensation there in the curvature as you were leaning. One more time, bend forward. All right, let your head relax. Okay, nice, smooth, long curve in the thoracic spine from the thoracic lumbar transition all the way up. There's not a lot of rib humping, which means the rotation is minimal. I don't expect a hypermobility issue with you. That's fantastic. So whatever cracking you're doing is most likely healthy and safe. As long as you're doing it consciously, drinking lots of water, stretching, yeah. All right, so I'm going to follow the sacrum down here to the coccyx, right? Do we have any tenderness here?
Yeah.
How about here?
Yeah, I'd say about equal.
Then there's corresponding segments in the occiput. So we just find this segment in the occiput that has this similar type of tension. Yours is right there. Is that a little tension? A little tense?
Yeah.
Okay, now we'll recheck. Is it still tender or is it the same, better or worse?
I'd say probably better. That's tender.
This one's still tender, right? Okay, let's give it a try. Deep breath. Good. Sinking out the back. Sink. Very nice. We're going to check the contraction of the lumbar muscle. So I'm going to lift your right leg up in the air.
Like that?
Exactly. Down. Okay, left. Good, down. Can do the right again. Okay, down. About even in height. Was either one more difficult for you? Try it again. Do the right. Down, left, down.
Maybe the left.
So when you lift the left leg up, the right lumbar paraspinal musculature contracted perfectly. So it means we have no issue on the right. Good, we're nice and straight up and down that way. Okay, deep breath in and out. This one's like this, forward, so I'm going to pull it back this way, and it's also external, so I'm going to push it back that way with my hip right here, okay?
Okay.
Nice. And your back. Nice, gentle breathing. All right, nice and gentle breathing. We're going to start on the right side first, okay? Nice and gentle. I'm going to bring your head over to the side like there. Very gently. We're going to follow your breath just like the other adjustments.
I like felt that one like all the way down.
Gentle, gentle.
Ow.
All right, ready? Hold your knees together now. Hold them together. Don't let me pull it apart. Hold it. Hold.
Oh, that's weird. I didn't expect, I was right in here somewhere pop.
All right, so this is a digestive organ manipulation, okay?
Okay.
It starts with the ileocecal valve. This is the window between the large and the small intestine. We locate it by first finding the belly button. Yours is here.
Okay.
ASIS, the front of your hip bone, okay? You can do this too. All right, so we connect these 2 points. In the middle is where we start looking for the ileocecal valve. Tender.
A little bit.
Nice, gentle. Can your belly breathe? Keep breathing into your belly. Okay, we're just going to follow the diaphragm along, release any tension.
Yeah, right on there is a little uncomfy. Because that's where it hurts when I normally get adjusted and people push on my back. It's right in there.
I think it's your ribs. Can I see your tongue? All right, put it away. All right, so do you know what's about to happen? Did you watch any of these adjustments?
Not really.
All you have to do is keep your teeth together. As you breathe out, we'll follow your breath like this. And at the end of your breath, we're going to go in that direction, okay?
Okay.
Just like the other adjustments, you'll only feel it for a little bit, and then it'll feel better afterwards, okay?
Okay. Oh, God.
Keep breathing.
Okay.
Breathe. Breathe through your nose.
Mm-hmm. There's so many feelings that my body doesn't even know what to focus on.
That's good. That's good awareness. Yep. Just keep breathing.
what are they called? Your little pieces of your spine?
Vertebrae.
In my brain, I feel like I just saw them all kind of like separate. I think my body was just very like
In shock.
overstimulated.
Walk
I
around
feel
a
like
little bit.
shaky almost. I feel weird. It's like loose, like a weird loose. I guess it's not a bad thing. I just don't think I'm ever this loose.
Push. Push.
It's always hurt, and then if I open, it gets stuck.
Open. Okay, close. Right there. Breathe. You need to do this at home.
Oh god.
If your jaw doesn't feel good. You just follow the line of your teeth back.
Uh-huh.
The first thing that you hit. Right. It's okay. This is the worst I've ever felt.
It's very sensitive.
Was it?
Don't make me laugh. It hurts. Okay.
Okay, look, it's getting better. Hold on. See how my fingers going a little bit further in?
Mm-hmm.
Because the muscle's releasing.
Oh, fuck.
Okay, you're doing good. Just keep breathing. Breathe. Good. In through your nose. Go. Out. Okay.